It's really a pleasure to be here again, and thank you, Dan, and everyone for making this happen. So I'm a surgeon. This explains the outfit. I feel more comfortable, but also we're in California, so I got Birkenstocks and I dumped the suit and all of that. But I'm a full-time surgeon, and I'm also sort of a geek of sorts. I love technology and how technology can really empower us. For me, it all started about 2012, 2013, because of this guy that you see on screen, Daniel Kraft at Future Med, and Lucien Englin, a good friend, that took this picture. This is the first crowd, and that's where I met Babak Parviz. Babak Parviz was the inventor of Google Glass. Google Glass was, as you probably all know, almost like the first smart glass or smart sort of AR device. And when I saw what the glass could do, I said, you know, we really have to use this in health.
What defines
I want you to hear this.
Possibility? A bright light in an endless space. For more than 3 decades, my job has been centered around certainty. The certainty of hope, of saving or improving the lives of those who trust me through surgery. Once you chase the ability to strive for certainty, the mind becomes restless. And that is the seed of possibility. Welcome to the world of extended reality. Through XR, we can understand the glory of our past, the pulse of our present, and the potential of our future. However, there's a greater possibility that XR presents. It can give us the ability to revolutionize the fabric of humanity, medicine, and education through technology. You can harness the potential and efficiency of your practice by enhancing your world through augmented reality. You can become a better learner through virtual reality by opening the doors to innovative simulations and resources, or interact with a hybrid world through mixed reality where the possibilities are endless. There's never been a better day than today to change our world for the better. My goal is to bridge the gaps in healthcare and education by instilling humanity and technology into the lives I touch. Join me in building a new world of possibility and certainty through passion, vision, and collaboration.
Thanks. I just wanted to bring that to you because to me it's about that, about collaborating. Extended realities, VR, AR, mixed reality is something that has been talked about a lot about, and it's something that we in healthcare have been barely starting to use just a few years ago. For me, as a clinician, the possibilities of collaborating in another sort of dimension, this XR dimension, are real. Google Glass, when I did the first operation with Google Glass shortly after Future Med in 2013, all I wanted was to connect a group of students to me through the live streaming. And you know, many people have done that later, afterwards. I did it with a couple of students. My dear friend Shafi did it with thousands of students not too long after that. And it was just about showing our perspective, about having a digital assistant of sorts in our face, in our head, connected to us. The history of this has been lengthy. VR has been around for a long time. We have had places like MIT where the first AR device was sort of concocted, and it was so heavy it had to be suspended from the ceiling. We all remember the famous Google Cardboard, right? That brought almost a virtual reality into a daily, easy, accessible reality. The devices have gone from a very, very slow progression, from very complex to very very sophisticated and expensive to very inexpensive nowadays. So we all, extended reality is something that we understand. Just a quick review, augmented reality, you are creating a digital world over the real world. You have mixed reality where that digital world interacts with the physical, and then we have virtual reality where you're completely in a computer-generated environment, right? And you are living sort of a different reality of sorts. And we all have seen simulators in the past, right? No one can fly a plane before they actually are in a simulator for many, many hours. We all have seen how virtual reality can almost change the mind. And if you have done an experience, you see how basically you are transported to a different dimension. You know you are on the ground, but you can't really step out of the actual area because you think you're going to fall. So all of that, in a way, has tremendous power in order for the experience to become real and become significant. We all have seen what HoloLens had done, years ago with the first edition of HoloLens. We have seen what things like medical holodeck have done, where you actually have a cadaver in virtual reality, and you are dissecting a cadaver, and you are learning anatomy like it was never done before, and you can have a multi-user sort of experience with no geographic boundaries. All of this is very, very powerful. If we bring mixed reality into the picture, you see what Gig XR is doing, where they have digital patients, actors that are in your physical reality, and it doesn't matter in the world where you are, you can bring that patient to your living room and learn about that patient, learn medicine, learn how to examine, learn how to diagnose in extended reality. So the power of this is real today. We talk about, the potential of things, but now the potential has been realized. In nursing education, we have already, in a way, revolutionized many nursing schools by bringing virtual reality to the curriculum. Bundle Arrays is a platform that allows virtual reality training at a distance, multi-user, and you can have any sort of activities that the nurses need to learn in order to professionally advance, but all in virtual reality. So there are platforms like Fundamental VR. I'm one of their advisors, by the way, an unpaid advisor, but I just see that what they're doing with nursing education, with the shortage of nurses that we have today globally, and trying to enhance the way the nurses train by bringing virtual reality capabilities to that curriculum. I think that is all only fascinating. I think that if you have a new grad, or you have a medical student, or you have a technician or nurse, and they need to learn a procedure, they can master that procedure in virtual reality. They can master that procedure before they actually go to the human. If you think about, for example, robotic surgery, and you see how many times you have to fly people all over the world to train the local people to do a robotic system setup. This is a video that Fundamental Reality did for the Versus, the CMR system. And again, all you need is connectivity, and you need a headset in order to master the setup, which is one of the key features of doing a robotic assisted surgery. As a surgeon, we all know the traditional tools, but now the tools have been somewhat replaced by these other tools that bring us to where we are today, and get us really excited and curious about the future. So we are in the now. So what's about the near and the next in extended realities? Well, I personally think that the list is very, very extensive. But, having multi-user capabilities, being able to collaborate in XR, what is being called the metaverse, That is the key, where you're not just alone learning, but you're collaborating and interacting with other humans, all without the boundaries of geography, where you have an exponential growth of the technology, where the technology is being adapted to mobile devices. We all know about AR Kit and AR Core, where everyone in their pocket, they have an AR device in their pocket. So that is something that is been progressing very fast, and it will continue to progress up to the point where we might not even have phones in our pockets any longer. One thing that is very, very exciting to me is the sensory integration, the form factor, the haptic ability within VR. That is something that is, for me, a game changer. And not just the haptics, but all other senses can be integrated into VR. I'll show you later where you can integrate basically the olfactory system into a virtual experience, enhancing and augmenting that experience. The costs have been decreasing significantly, and now we are, in a way, democratizing the access to these technologies in a way that we couldn't do it before. So a platform needs to be multimodal, multiplayer. A platform needs to be scalable, needs to be accredited, needs to be validated for the outcomes that it produces. It needs to have data insight, enabling effective knowledge and skills monitoring. It needs to be AI-powered. We heard a lot about AI and how it can potentiate what we do, and it has to be cost-effective. Cost-effective is very, very important. You saw the graphic of the cost, and that we cannot continue to spend money that way without significant results. So this platform that Fundamental VR has been focusing on has the power of the haptic connectivity, and I think that brings it ahead of some other incredible other technologies out there. You have also VR, you have a Precision OS, you have Orama VR, but I think that the haptics integration is very, very important, and we have been proving that that is something that it really, really makes a difference. So I was going to bring the haptics glove, and I didn't have the chance to do it, the new generation here on stage. But again, having the ability to feel what you are seeing in virtual reality really, really changes the game. This is a company from the Netherlands called Sense Glove. They have their new platform called the Nova glove, and it's really phenomenal. It's just a glove that allows you to feel in a way what you are touching. Brings that sensory of touch, the haptic sensorial input to the actual experience and making it more real. So in a way, I think that we are living in a time that has never been like this before. We, in everyday life, but especially in healthcare and in healthcare education, we have come to places that we couldn't imagine. Who would have imagined that you can smell VR, that you can cook a pizza or learn the steps to make a pizza in VR, and then you can smell the aroma of mushrooms or tomatoes or whatnot. And this should have sound, I think. But I think it's important in healthcare. Skip Rizzo in California have taken advantage of this platform or similar platform to bring soldiers that have PTSD into the battlefield with the smell of burnt powder or burnt rubber. I think that has really, really a strong potential in order to improve the experience and make it more real. In the operating room, we talked about education, we talked about diagnostics, but in the operating room, we have technologies like Apocular. Apocular is, in a way, changing the way we do surgery, because you can bring all the data from imagery that you sometimes need for surgery, and you can manipulate that data in real time in 3D, and you can, in a way, change the outcome of the surgery by improving how you interact with that digital data. You have RSQ, that is also a fantastic platform which brings any sort of endoscopic or digital input into that VR or into the XR, experience. So this is the real today. This is the now. I think that we need to keep in mind that these technologies are really developing so fast and so quickly that it's really hard to keep up with them. Many of the surgeries that you see here are surgeries that are not being done even in the United States. So it's becoming really a global phenomenon in a way. You can have the real time, the real real physical surgery data, but also you have XR data that is sort of superimposed and enhancing that activity that the surgeon is doing in real time. At the end, improving the flow of the surgery, having a more human-centered experience, and having better outcomes at the end, which is really what counts. I'm finishing a master's at Cedars-Sinai, Health Delivery Sciences, and my capstone is on using that extended reality in order to bring the EMR to the bedside. So why are we not using XR in order to interact with the EMR on the point of care, on the patient side? We all complain about EMR, and it's really a terrible shame that the way we interact with the EMR today involves taking the physicians, the nurses, the clinicians towards the path on burnout. I think that we need to bring that experience to be really appropriate to the 21st century. There are repositories of data that are unbelievable. You have the Blausen experience, for example. Blausen has an incredible amount of very high physiologically and anatomically correct images that are basically available to bring into the ER, to the VR world. If you link those images to the EMR, I think that the experience could be really phenomenal. If you bring that AI algorithm component, something like a ChatGPT, you bring that possibility to the experience, and then you make that experience really much more fluent and really something that really makes a difference. It's a collaboration. It's becoming still a better human, not isolating ourselves with technology, but actually reaching out to others with technology, having technology be a bridge to what we do. Shafi will talk to you guys later about what Medis is doing and creating a metaverse, creating really a space where you can digitally be connected, improving the world flow of receiving care. This is something that, again, is not a possibility. This is something that is here today. I think that we need to reimagine how we connect, for example. This is something that we did about 4 years ago, bringing avatars into a physical space and all connected from different parts of the world. You can actually basically interact with another clinician, learning or teaching, democratizing, in a way, learning, democratizing expertise. If you think about platforms like Proto, where I tried this at AWE where I spoke, and you can have a simple device bring you speaking in real time, seeing what you need to see, and also having your whole self, in a way, presenting to other person. Imagine the potential of this for home care, for example, to have a person discussing with you what the plan of care is. We are in an age of really excitement, an age that is bringing technologies that were unthinkable before to be a reality, where you have possibly smart glasses that will go in your eye. You have a contact lens that will really allow you to enter that XR space. I'm a fan of science fiction, and you all know about the blue pill, right, and the red pill. And if you choose that red pill, possibly I'll teach you how far the rabbit hole goes. So I encourage you all, and I know you are because you are here, but take the red pill, because we need to embrace these technologies in order to make healthcare more humane and more accessible to the rest of the world. Thank you very much.
You forgot something. So you trained as a C1 do one teach one surgeon,
yes, sir.
As did I. So the 10,000 hours to get what's going to happen? Who can be a surgeon in the future with these new types of technologies?
Well, I really think that technology is enabling access and enabling also the flow of knowledge. And I think that a technology like the Magic Leap 2, I was going to bring it on stage, and I thought it was going to be really clunky with my microphone. But I think that these technologies can really bring education to anywhere at any time. And you can, like that pilot on the simulator, you can bring expertise, improve performance in a cost-effective way to anywhere in the world. And again, democratizing teaching and learning. I think that that's sort of the key.
100%.
We were inspired by the fact that you were wearing your scrubs. And it's so important because medicine, surgery, healthcare, it's a team sport. So question for you, and I really loved how you were talking about training and specifically nurses, how they're training. Question for you, do you ever use music in the OR?
Absolutely. Music,
And tell me, does it help?
well, yeah, it helps. It helps chill. And I usually don't have my own playlist like many surgeons do. I actually and that's the way to, whatever the nurses want, whatever the nurses want. So
Smart man.
the playlist,
Smart surgeon. Smart surgeon.
Go faster. And
Yeah. How many of you ever use music and find that it helps you in your performance? Well, you are not alone, and there's actually data and evidence and research to support this. So we have been working on a fun collaboration with our friends at Click, who found some research. Actually, they didn't find it. I mean, it's really taken off. There was some group of folks that were looking at surgical performance and wondering, does music actually improve performance in terms of accuracy, precision, team cohesion? And the answer is yes. So question is, how do you bring that to life? Well, count on Click to be able to do that. So if we can cue this
Well,
video.
actually, it's not any music.
Well, don't spoil it. Don't spoil it. Yes, it's not just any music, and it's not just any genre. There's a very specific type of music. So if we can cue the video and run this and get ready to rock on.
There are 313 million surgeries every year, but only 1.2 million surgeons. And surgical complications are the third leading cause of death worldwide. So how can we help surgical teams stay efficient, energized, and in the zone when lives are on the line? NextMed Health presents Life-Saving Radio, the world's first album and AI radio station clinically designed to improve surgical performance and help surgeons save lives. We started by rewriting the songs of AC/DC, the band clinically shown to amplify surgical precision. Then customize the OR audio experience to maximize its surgical effect.
Hey everybody, it's Dr. Von der Wright, and we're about to play Highway to Heal for the first time in my OR, so let's go.
Good morning, Dr. Von der Wright. I'm your AI DJ, AI Angus, here to help your surgical team stay as sharp as a scalpel with a custom surgery soundtrack shown to amplify efficiency. And you're operating to the title track off Highway to Heal.
Shown that music can affect performance. What we want in surgery is to be extremely accurate and precise and be in the zone.
I love how life-saving radio can help our teams achieve flow state to reach peak surgical performance, ultimately improving patient outcomes.
It's a perfect example of the super convergence of big data meets AI meets personalization, starting off in the operating room.
We are so excited about life-saving radio and what it's going to do for surgical performance.
Scrub in and rock out to life-saving radio. Up and roll.
And here you have it. It's no longer Highway to Hell, it is Highway to Heal. And so from this research, actually what we found is this music, the amplitude, the pacing from AC/DC is actually what is helping to improve surgical performance. So what you heard there is not Highway to Hell, it is actually Highway to Heal. Click worked with their incredible creative team, and they've come up with this new album where they've taken 11 of AC/DC's tunes. They have rewritten all the lyrics that looks at surgical conditions, surgical procedures that they're going to do, and they have created this album. And in addition to that, life-saving AI radio, because the whole concept of how do we use AI to customize the surgical performance, to bring teams together, and to actually not only improve the performance and the accuracy and the precision, but the patient outcome. That's the ultimate piece. So you actually got to experience this in your OR.
Yeah,
Thoughts?
It's brilliant. I'm not much of a music guy, to tell you the truth. And I listened to all this music in English when I even didn't know English. So I focused on the rhythm, but not in the lyrics. But then, with time, and especially, I was trying to understand the lyrics, and I really couldn't. But when you read the lyrics, and they're all, oh, that's not the original lyric. That's actually a medically oriented.
Yeah, you sold me all night long.
It's unbelievable.
Sold me all night long.
It's unbelievable. Yeah. I think that it's a great a movement, and I think that having it on a vinyl sort of record, it's actually very interesting.
Well, I don't know that anybody has record players in the OR, but we all are using our playlists. So that's really the beauty of DJ Angus, is bringing all of this to life. We had a couple of shots here of what that's going to be looking like. So while you are here at NextMed, we are going to be introducing you to all sorts of new tunes that you're going to be able to rock out, scrub in, rock out,
karaoke,
and improve.
Sing along.
Karaoke, the disco, and tomorrow. So you see, we've got the next. Yet to be NextMed scrubs. But these are also going to be the high-weighted heel scrubs, because tomorrow, starting early in the morning, you get to go customize, and you'll get to have whatever we've got 4 options of logos for NextMed, but on the back, you're going to have the high-weighted heel rock tour. So we will have all of that listed. And you can go out there and go get those printed. So anyway, we are super excited. You are going to learn a whole new set of lyrics to rock out to.